The new space that we have is perfect because it's in a very dynamic environment. Students are always looking for the most up-to-date, so that's very fresh, but yet there's a very warm feeling about it.
Group Health Cooperative recently expanded its services to the local community with a new clinic on the Madison College campus. The new space is so successful, healthcare professionals come to learn from it. It was the school calendar, however, that dictated opening day. The team decided custom prefab for the interiors was the only way to make the date.
Being on time was probably the most crucial part of what success looked like.
It was a new concept for all of us, and to be able, we had such a short time frame from the time that we decided on the final plans to the time of having it installed and opened, and just to see how quickly it went together. And if we did decide to make a change, it did not impact or hold up our workflow at all to get the clinic open in the time that we needed.
It's 180 degrees different. Going from looking at a piece of paper which you pencil out, and then 3 days later or 3 weeks later you get a rendition in a PDF format and people look at it and go, boy, is this what I wanted? I don't remember the conversation which drove this design. ICE is phenomenal. It's fun and fast.
Anytime we made a change, we could say, okay, it's going to cost about X more or X less with this finish you've chosen, instead of having to put a call out to someone who says, let me call that subcontractor and find out.
There's a lot of actually usable space in here. The huge advantage is seeing it all in a three-dimensional format. So it really helped us to know that we don't need this much. Or this office, yeah, we're a little bit tight here, and we knew it up front.
The optimization of real estate was vital to the return on investment. However, efficient space couldn't trump the performance or feel of the clinic.
People are surprised at how much we've been able to do in such a small space.
We've used every inch of this clinic and thought about its purpose, because you're able to use DIRTT to kind of challenge why things were done the way they've always been done before. When you actually hang something on the walls, you do create efficiencies in space. One example is using the barn doors actually creates a bigger feeling in an exam room.
That's the other piece of this that's really great, is if staff don't like quite what they are, they can be moved, where a drywall mounted unit is there permanently unless we have a facilities person come and move it for us. So that's also a really nice feature.
I'm in charge of budgeting my staff's time, and really I don't budget time for repairs at this facility.
The patients love it, the staff loves it.
Perfect.
We've gotten the nickname of the crown jewel of GHC clinics.
We started out from desks and pens and papers, and then an occasional monitor, CRT, would pop up in a room, and we'd kind of live with it. This is a totally different animal. It's more reflexive. It'll allow you to make for a change on the fly, and more importantly, through ICE, you get to see what you're going to get as a result of that change, because it's so vivid in front of you, even though it's on a computer screen.
3 feet 9 inches and 3/4. You almost.
So we have to be as efficient as possible. We have to be able to communicate quickly, and always keep that pace in such a way that the patient always feels like we are prepared to be there for them. So it's kind of an interesting juxtaposition of experiences, because healthcare is expected to be constant and going, but yet you come in, it's like you can be fast and slow all at the same time in this space that I don't experience in our other spaces.